In the last few classes, we had discussed about the general principle involved in the management of poisoning, where we came across with various principles like stabilization, evaluation, decontamination, poison elimination, antidote administration, nursing and psychiatric care. Out of it, we were discussing about stabilization. The stabilization involved assessment and corrections of life-threatening events. So this assessment includes ABCD, where airway, breathing, circulatory failure or any CNS depression observed. So that should be managed. Respiratory insufficiency should be addressed. Circulatory failure, cardiac arrhythmia or CNS depression. Up to the last video, we had discussed about such things. So today, we will be continuing with the respiratory insufficiency as a part of the management of airway and breathing insufficiency, which may be observed in many poisoning conditions. Because already we have quoted we will be carrying out supportive care technique in many poisoning conditions, even whenever we are not aware with the nature of the poisoning. Let us see how to manage this respiratory insufficiency. The first primary work we should maintain, that is the establishment on open airway. So in order to give some oxygen therapy or some ventilation, it's essential that the airway should be clear. The first work, remove of any dentures. So commonly with many people, so they may be having one or the other aids in the mouth, or any time the foreign substances which may be present in the mouth, which may interfere with the airway. The first work, removal of dentures, should be done. Followed by use the chin lift and jaw thrust technique. So it will clear the airway obstruction and also prevent tongue falling back. So with the help of the picture, we can analyze it. Head tilt and chin lift technique. Head tilt as well as the chin lift technique we can go with. And jaw thrust can be observed with the diagram. You can observe so that the passage will be open, so that air can be get passed out. So, but while using this open airway technique, try to avoid head tilt if neck injury is observed. In many other cases, with the help of this, like opening airway, passing will be observed and it will become easier to enter the air. Chin lift and jaw thrust technique can be used, where we can prevent tongue falling back also, whereby the obstruction can be overcome. While doing that, you should follow with some precautionary measure. The first thing, you have to remove out the saliva, otherwise aspiration of such things may happen. It should be prevented, or sometime vomitus, that should be removed, or sometime any bleeding happened and the blood, any other things which are present in the mouth, that should be removed. So this can be done by using some suction pipes also, it can be done, or a very simple technique by using the finger sweep method, it can be done. With the help of the picture, you can observe it. So to tilt a person to one side and open the mouth. So then we should go with tongue jaw lift technique and locate the obstruction. You can make your finger like a hook. You can observe here in the both diagram. You can make it as a hook. First you have to locate the obstruction and insert the finger, make it as hook and sweep out the object and remove the object outside, so that the passage will be very much clear. So next, in order to improve the respiration, we can use this lateral semi-prone position, where one leg will be placed above the other. In between you can observe a pillow, and the second pillow can be observed below the hand and below the head. In the lateral semi-lateral position, the respiration may be improved out. This can be followed with the patient. Then also if required, then you should go with inserting an intratracheal tube. So this endotracheal tube is a flexible plastic tube that is placed through the mouth into the trachea. It's a windpipe to help a patient to breathe. The endotracheal tube is then connected to a ventilator if required, which delivers oxygen to the lungs. The process of inserting the tube is called as endotracheal intubation. Further, if ventilation is not observed adequate, so we can begin with some artificial respiration by using ambu bag. So here with the diagram you can observe some valve mask we can observe. So this mask will be placed in the person mouth and nose. So then a pressure will be generated in the bulb so that we are going to pass air into the person, whereby it may help or improve the respiration in a person. Followed by oxygenation therapy should be started. Initially we were had discussed about oxygen delivery to a person. So some precautionary tests also should be done in order to check the concentration of oxygen. This we have discussed earlier. To raise the partial pressure of oxygen to at least 45 to 55 mm Hg, so around 6 kilopascal to 7.3 kilopascal, it can be achieved by raising the pressure of oxygen. So it can be achieved, we can begin with the 28% oxygen mask. Then you have to observe the partial pressure of oxygen in the blood. So depending on the response as assessed, periodically atrial gas analysis should be carried out so that we can shift on between 28% or a little bit higher 35% we should proceed of. So our ultimate aim, we should reach at least 45 mm Hg to 55 mm Hg. Either if you are not reaching, we can increase the concentration up to 35%. If the condition is still it's not controlled and deterioration is happening, so then we should go with the assisted ventilation. This is all about the respiratory care. So then coming with the circulatory failure. If circulatory failure is observed, so the first we should go with the correcting acidemia condition if it is present in a person. So this acidemia condition is nothing but increase in the H plus ion concentration in the blood. It's nothing but the acidic environment where the pH of the blood will decreases towards the acidic range. So that should be get treated. So in the coming slide I will be mentioning how to overcome such situation. So in cardiac failure condition, elevated food end of the bed can serve the purpose where it can increase the circulation. So now in order to improve the circulation, so the blood volume can be raised so that we can insert a large bore peripheral IV line. So number 16 gauge or larger, and we can start administering the fluids. It's called as a fluid challenge. Initially we will be giving 200 ml of saline. If in the children 10 ml per kg, those will be administered. So after producing this fluid challenge, observe the patient for improvement in the blood pressure. For 10 minutes of time, the blood pressure should be checked. So then repeat the fluid bolus if BP fails to normalize, and assess for signs of fluid overload. Because we should not keep on administering the fluid. Simultaneously you have to check any overload of the fluid is happening with the patient or not, and along with that you have to monitor the BP, whether BP is rising because of the fluid challenge test. So then followed by hemodynamic monitoring should be considered in those patients even they are not responded for 2 liters of infusion. In them, like short term low dose of vasopressin, vasopressor agents such as dopamine and non-adrenaline can be administered. As you have heard about these vasopressors, vasopressors are the agent which raises the blood pressure. Like dopamine or noradrenaline can be administered, so they act as stimulation. So vasoconstrictory responses can be observed, so thereby rise in the blood pressure can be seen. Vasopressors can be administered. Followed by you have to check the ECG in hypotensive patient, and also we should note the rhythm of arrhythmia and any conduction delay is happening, so that should be observed. So in patient who are not responding to the initial fluid challenge monitor, it's better to check the central venous pressure and also urinary output. Hourly basis it should be checked, because we should monitor the fluid overload also. So then vasopressors of choice like dopamine or norepinephrine can be used. If you are using dopamine, begin with 1 to 5 micrograms per kg per minute. The maximum begin with 15 to 30 microgram per kg per minute, and we should go with the titration. So here we should always check the BP and you have to titrate the dose according to that. So we should maintain a basic systolic pressure between 90 to 100 mmHg, and we have to check the blood pressure every 15 minutes. Other option like noradrenaline can be used. Add 8 milligram, that's 2 ampoules usually to 500 ml of 5% dextrose solution to make a concentration of 16 micrograms per liter, and start at 0.5 to 1 ml per minute and titrate to the clinical response. Monitor BP every 5 to 10 minutes until a clear blood pressure trend is re-established. Then if a person is suffering with cardiac arrhythmias, it's better to obtain ECG and continuous cardiac monitoring and oxygen administration, and we should go for evaluating hypoxia as well as acidosis condition in a person, and even electrolyte disturbances should be checked, like hypokalemia, hypocalcemia and hypomagnesemia should be checked off. The drug can be administered to overcome these cardiac arrhythmias, include like lignocaine and amiodarone can be administered, which are considered as a first line agent for stable monomorphic ventricular tachycardia condition, which will be underlying with some impaired cardiac function. Or second, sotalol is an alternate for stable monotropic ventricular tachycardia. Amiodarone and sotalol should be used with caution if the patient is having prolonged QT intervals, and even atropine can also be administered if a person is having severe bradycardia condition. The last bit, that is the CNS depression. So many times the reason of poisoning is not known. Whenever CNS depression is observed in the patient, usually general treatment we are going to start by giving 3 antidotes. This is a set of antidotes called as coma cocktail. So it will be administered intravenously, like dextrose, thiamine and naloxone. In a combination it can be used. This combination is called as coma cocktail combination. So the rationale for the coma cocktail combination was that a significant proportion of poisoned comatose patient in whom generally will absorb some poison, that may be opiates, alcohol and hypoglycemic agents. Naloxone used in the cocktail mixture in the coma patient, so it may block the opiates, because unknowingly the nature of the poison may be considered among all the three, like opiates, alcohol, hypoglycemic agents, and generally the treatment can be given. And what the dextrose present in the combinations, it may overcome hypoglycemic responses which have shown because of many agents which got ingested. And what the thiamine deficiency which can be observed in many of the poisoning conditions including alcohol. So this combination may serve to protect the person from many complications. In general it can be given, and even unknowingly the poison nature, if such agents have given also, they are harmless and it won't show any adverse effect in a person. So that this combination is preferred until the nature of the poison is known. So then all the patients with the depressed mental status should receive 100% oxygen in a mask, like high flow 8 to 10 liters per minute. It should be administered, like hyperbaric oxygen therapy it is called as. Higher concentration will helps to protect the damage of the brain in further. So then coming with the evaluation, we are talking about the CNS depression. Already we had came across with a coma rating scale, Glasgow coma scale. With the help of that scale also the evaluation can be done. So if the patient is not under any crisis, how we can suggest means, like if he is alert and if he is having normal speech and pulse, so that we can proceed to complete and thorough and systematic examination can be performed with him, where the neurological examination can be done, like mental status can be checked, speech, cranial nerves activity, motor system can be assessed by the posture of the patient, and muscle, tonicity of the muscle or power of the muscle can be checked, or we can check about the involuntary movements shown by the patient, and even sensory systems can be checked, and also various reflexes can be analyzed thoroughly in order to check the alertness of the brain. So then, as far as the treatment is concerned, the emphasis should be given on the basic supportive measures. Up to now, we had discussion about the supportive care measures under the heading stabilization. We have covered the assessment and management of airway breathing complication, circulatory failure and CNS depression, and we have discussed about the management of the parameter. In the next video, we will be seeing about the next aspect under the general principle of management of poisoning, that is the evaluation. Let us see what are the different evaluating parameters are included in the management of the poisoning. Thank you.